Okay, well, hi everybody. Apologize, I need to get my microphone in here. Hi, I'm Dr. Sally Foote, and welcome to my Facebook Live. I am a veterinarian and an animal behaviorist, and I also take these Facebook Live sessions to talk about behavior topics. I provide a lot of educational content. I create content. I'm a speaker and writer for low stress pet care, and you can find me at my website, drsallyjfoote.com, and I also have a YouTube channel and my Facebook page. So today I wanted to bring up this recent paper I saw, and this was from the British Veterinary Journal, BMC Veterinary Research, and it's talking about the pain behaviors that we see before and after cats have a dentistry. If after cats have received, treatment for teeth problems. So while it's a long paper, if you go to I did post the link to this abstract on my Facebook page, and if you read through the whole thing, I think it's about 30 pages. But I'm going to hit the highlights here, like I do when I review some of these different research papers. Especially where these research papers are blending, the knowledge about a physical medical problem and how it may reflect or reflects in behavior changes or behavior effects. So this veterinary research article was where they took two groups of cats, one which we called like moderate or mild oral disease. So primarily they had gingivitis. And gingivitis is that just red line, that little ring of inflammation above the gum line. And this would be to a moderate degree, not severe gingivitis, okay? And then the second group was more advanced dental disease. That the cats, they didn't get into the specifics about what the dental problems were. But when the cats were in this more severe disease group, these were cats who had extractions. So really the differentiator is, did they need maybe just prophy cleaning, or did they need extractions, to differentiate which group the cats fell in? Now there were boarded veterinary behaviorists that judged the behaviors of the cats, and the cats were kept in the hospital setting for the week. They had a time to acclimate to the hospital setting before doing the study. So this was to decrease, any kind of probably stress behaviors, just because they're in a new environment. And also in this study, the cats who already had a temperament of being somewhat fearful or stressed were not included in the study. So these were cats who had pretty much, before the study, showed they wanted to maybe, liked being petted or accepted handling, were not stressed out by a lot of noise and so on. So in the study, the three things that were found from the study were that the cats who were in the higher pain group showed less basically body movement. When I said tail movement or moving their body around, the cats who had the extractions and higher level, more advanced dental disease would not play with the ribbon in the cage. So they did the same, enticement for play between the two cats. Then lastly, between both groups of cats, they would eat wet food readily, but chewing on the dry food, the cats who had had extractions, they would show more evidence of dropping the dry food or they would get it in their mouth, okay? They get it in their mouth, but it would be a bit more work for chewing it or swallowing it. And lastly, some of the signs of the cat, like having that little bit of difficulty. And that's what I want to talk about, is the behavioral signs that we see. So, first of all, it's 24 cats. And I thought it was a little interesting that in the group with the more advanced disease, there were more males than females. We don't really know why. One thing, and it's, wasn't written out about this, if the cats were screened for feline leukemia or feline AIDS ahead of time. But, male cats can have a higher rate of the feline immunodeficiency virus, and that can cause more gingivitis at a younger age, which may be affecting them at an older age. Okay, I don't know. But anyway, just want to throw that out there. Maybe that's why the young group was primarily female, like 9 out of 12 cats in the less advanced dental disease were primarily female, and in the more advanced dental disease, they were male. Now, what I like about when you go through that link, you can open up the different tables, and so that you can really see there was a lot of behaviors they were like looking at, yet for significant difference, it only boiled down to those 3 that I talked about: play, eating, and how whether or not the dropping of the food. So that was, I think, what was good was that they did try to look at many of the other kinds of behaviors, like how close they sat to the cage versus to the back of the cage, etc. Let me go through this real quick. Now, I think it's important to note that between both groups, they had full anesthesia. They did have radiographs. They had the cleaning. They were given the same pain management, after care. And of the higher, the full extraction group, there were quite a few, I think there were 5 or so that needed to have rescue analgesia. What this means is as they were waking up in that 5-hour period post-operatively, they had, nerve blocks, that the cats were showing either vocalization or other signs that they were having breakthrough pain. Now, the Glasgow feline pain scoring technique or chart was what was used. So it was a universal pain scoring method and medically accepted pain scoring method for judging these cats for pain as part of the behavior analysis in this study. But anyway, for the cats who needed rescue analgesia, some of these cats' responses for after the extraction were excluded, and as in the discussion, it may be important to actually look back at that, because that may also be something to consider with, after extraction. So when you go through the paper, you're going to see, you can actually click and open up these actual charts and these tables. But what's really good to do, and I want to encourage all of the veterinarians and veterinary staff out there, shelter care staff out there, and feline behaviorists that are not in the veterinary profession, to play the video of how they were, because it's a side-by-side comparison. There's the video of the cat with the lower, amount of oral disease, and the cat that has a higher amount of oral disease for the behaviors that they were assessing, such as position in the cage. The cat with the lesser oral disease is more up at the front of the cage. They're looking around. They're wanting to rub their face on the bars. The cat in the back of the cage has their full body out and relaxed. The arms, the paws are extended. They're showing a lot of body relaxation. They're staying a little bit, some of them were staying more toward the back of the cage. You'll see some other example cats that had the higher amount of dental disease that are coming to the front of the cage. But what I found significant, or myself, I felt this is really worthwhile to notice is we're literally comparing these 2 cats, is the cats who had the higher amount of dental disease, even if they were at the front of the cage, which is often a good, what we use as an indicator for the cats, happiness and welfare, especially in hospitalization or in shelter care. The cats with the higher amount of dental disease, they were not wanting to move their head around, and they were not wanting to headbutt on the front of the cage. And that makes sense. If they have pain in their face and pain in their head, that's to a higher degree. You'll also, if you really look at those 2 videos, you can see a lot of wincing. In this case, it was like an orange tabby cat in the video. And like I said, you're going to have to go through the legs. I'm not that highly technical enough to show it on this video. But you'll see that orange tabby cat kind of doing the, and you'll see a bit of the furrowed brow. You'll see a little bit of the tightening of the face. Now remember, cats' body language is more subtle as compared to the dog. So you have to become accustomed to looking for this subtlety. So Sorry, Binks I don't think would tolerate me showing a lot of times. I have my stuffed cat. So in the wincing, and remember, wincing is going to be where the eyes just flatten out. Like they're closing their eyes, but they're not holding them like real tight like that. They're just closing them and holding them closed for like a second. And then they open them as compared to a regular blink. And then you look to see that whisker position. As I say, if you can see the gap of air between the whisker coming out this way and the side of the face, that is whiskers forward or whisker tension, which is coming from facial tension. And facial tension is an indicator for pain, not only anxiety, but also pain. And so in these videos, as they're comparing the cats, I think that's really good for us to learn to observe and put it all with the big picture, okay? Because a lot of people might say, oh, that cat looks happy. He's at the front of the cage. True, and he may be very acclimated to where he is. Again, they were choosing cats who are not stressed about being at the veterinary practice or in this setting. Yet, look at how he's holding his face. And look at how he is not like, we're not talking about upset, twitchy tail, but I mean just kind of moving the tail around as he sits, kind of, you know, lifting the tip or not, because that's all a part of a cat showing they're attentive to their surrounding. In that side-by-side comparison, you will see the cat with the lesser amount of dental disease doing more of like just a little tail curl, tail movement, body movement, getting up, just, you know, moving their body around more than the cat with the higher degree of dental disease. Now, of course, after the dentistry, then there was the evaluation of playing with the ribbon. So when you watch the video, what you're going to see is the cat that had the higher degree of dental pain, he's looking at the ribbon. He may paw at it once or twice. The cat with the lesser amount of dental disease will paw at the ribbon and actually grab the ribbon more with its paw. They are moving their body more. Now, they may grab a bit with the mouth or not, and the dental disease cats were far less in grabbing with the mouth, grabbing with the paw. The dental disease cats looked at the ribbon more, so they were interested. They were getting enticed into play, but they were not moving their body into the play. The cats with the lower dental disease would look at the ribbon, would move toward the ribbon, would go grab at the ribbon with their paw, and maybe a little bit with the mouth. So again, we're getting back to body movement. So body movement was much less in these cats with the higher amount of dental disease, and that can translate into other ways that they move around in the home. Now, head shaking. Excellent capture of this on that video in the link to the article. So please go to that video and watch it, because toward the end is when they're showing the eating behavior, I should say. And so they have, you know, the cat with the lesser oral disease eating the mixture of, I guess, dry and canned food, and then the cat with the more advanced dental disease eating the dry food. Both cats go right into the food and they're eating it, but you can notice that the cat with the more advanced dental disease is dropping more little nuggets of food. I mean, as he's eating, it's dropping out of his mouth as compared to the cat with the lower dental disease. Watch how the cats take the food in their mouth and get it in the back of their mouth, and how they're using their jaw muscles and their facial, you know, their face and their body for eating. Again, subtle differences, but they do mean a lot. The cat with less dental disease, he takes his mouthful and you see him kind of do that throwback, and he chomps it up and he swallows it and he gets right into the next one. And there may only be one little nugget dropped out of all this eating the cat with the lesser disease does. The cat with the greater disease, he puts his face right into the bowl, he goes ahead and he gets the mouthful, and then he extends his head and neck. Do it like, here, I'm gonna get my stuffed cat, that's why I have it here, right? He extends his head and neck like this, and then you can really see how he's chewing, like working on chewing with the jaw muscles here, because the head and the neck is extended, and it's almost like he's like pulling out like this as he does it, as compared to the cat who kind of just throws it back and he sits with his head level, chews it up, and goes right into the next one. So prehension of the dry food and how quickly they eat the dry food, how easy it is for them with swallowing, was more difficult for the cats with the higher degree of post-operatively, for the cats who had the extractions. Now, I'm sure that's very understandable. because there's a lot of gum tissue that needs to heal. Both these groups of cats were maintained on 3 days of meloxicam postoperatively at the appropriate doses. Now, this is a European study, and I want to talk right now about meloxicam to my veterinary colleagues in North America. Meloxicam at the low doses, and this is a study that was done in Australia, I believe in 2010. Sorry, I don't have the actual date right in front of me. But in a study in Australia where cats with early renal disease were given meloxicam to help manage their chronic pain. And the meloxicam was at a dose 1/3 of the typical dose that we use in the United States, because our FDA approval in the United States was at a higher dose of meloxicam. At this lower dose of meloxicam in the cats with renal disease, these cats gained more weight, their blood urea nitrogen and creatinine levels were lower than and they were moving around, grooming themselves, and had better welfare than the cats with early renal disease who were not given meloxicam. Okay, so in Europe, meloxicam is used frequently for postoperative pain at the low dose for cats. So this was what was used as part of the postoperative for 3 days postoperatively for managing the pain in the cats. But this change in being slower to eat dry food was similar for both cats, more pronounced in the cats with the extractions. And so that to me says we need to extend longer our anti-inflammatory and pain relief medication, for these cats, because while they are eating and they are using the litter box and such, these subtle changes in how much they're moving around the house, wanting to play, and how they are, chewing and consuming their food are indicators of some body discomfort. And we need to be thinking about that as we send these cats home after we do a dental. Now, there's a couple of really great things about, of course, this study is, first of all, it's one of the first studies where actually evaluating feline behaviors post-operatively, for that extended period, for days afterward, and a comparative one. And so I think that's really good, because we need this. We don't have these many studies, in feline medicine. I think the second thing that's also important is, and I'm going to just kind of take this a little step farther, is after these cats have gone home, we need to be thinking about how are they moving through the home? How are they actually using their, how are they getting in and out of their litter box? How are they able to get up and down out of their perches and walk across a living room floor with, say, confidence and ease? How are they holding their tail? How are they holding their head posture-wise? Because this is now going to telegraph, it's going to communicate to the other household cat. And if we have a kitty who after dentistry, can get up, can use the litter box, is eating, if we call our clients and say, how is he eating? Well, he's eating the soft food pretty well. Oh, yeah, he's been kind of munching on his dry food through the day. And we think, oh, okay, that's cool, that's good. Actually, because he's slow to eat the dry food, it may set up the other housemate cat to come in and eat more frequently, increasing the competition and potential housemate aggression. If the kitty who just had his dentistry and of course had more maybe dental care needed or extractions, and it's on day 4 and 5, after the dentistry, and he's now still feeling some facial pain, he may be slower to jump up on that cat perch to get away from the other cat who's down on the, down on the floor, walking through the floor. And so now we have 2 cats on the floor doing, like I say, that 2 airplanes coming in on the runway. And now we get a hiss from this one. And this one may hiss or may not, because it may hurt to hiss. Remember, they just had a lot of dental work. So they may not be hissing back or growling back. And then this one may get more bold. So this is how we need to think about this. And I would suggest that we increase how long we have these cats on pain relief medication. We advise our clients more clearly for wet food, canned food over dry food. And if they say, well, my cat won't eat dry food at all, canned food at all, he only likes the dry food, then maybe find like a semi-moist diet or ways of putting the dry food, soak it in water a little bit to help it to be easier to eat. Or lastly, maybe consider, again, longer duration of the pain relief medication. Now, when it comes to giving medication, lastly, very last thing I'm going to say is let's really think about how is a client going to get the medication into this cat. Because any kind of holding the face, holding the head, or holding their body may then create owner conflict because he's still tender and sore or just kind of irritable on his body because of the dental extractions. So I really want to recommend very highly that we think about primarily using more of a liquid, avoid tablets, avoid pills, because they're hard to hide in the food. If you grind them up, it breaks the coating, they taste bitter, and pilling the cat is probably one of the worst things for this cat to go through after dentistry. Long duration injectable antibiotic like Convenia, that would be a very good idea to use, that when antibiotics are indicated or anti-inflammatory is indicated. The longer standing buprenorphine injectable, that also would be helpful as opposed to even doing the oral transmucosal. Liquids, especially if they can be either compounded with a strong flavoring agent to hide the bitter taste. Gabapentin is extremely bitter. Now, I am not going to give dosages, and I cannot give ways to compound or mix this up for individual use across a FaceTime or Facebook live streaming. That would be very inappropriate of me to do. Veterinary staff, you can message me, email me, and we can discuss this. I present this often in a lot of my continuing education, especially on low-stress feline care, through my CE. But there are ways to use products like lactulose or honey to then create the liquid that you can put in a small amount of very flavorful canned food so that the cat will take it down. But we really want to avoid any holding of the hands, holding of the heads. And lastly, of course, transdermal. Using transdermal gels or thinking ahead of time before the dentistry to go ahead and have that compounding pharmacy already create that transdermal product. So when you do the dentistry, it's available to be used immediately for your feline patients, and we don't have a 1 or 2 or 3 day lag on getting that prescription to them. Thank you very much. I appreciate your time. I'm really excited about this, study that's done. Look in my posts here on the Foote and Friends Facebook page for the link. I will repost the link to the paper. And I also look forward to hearing from those of you in feline practice, some of you clients also who've had cats, who've had dentistries, how you helped your cats manage or what you saw, some of the behaviors that may have changed at home, even if it was just for that 1 week, that first 1 week after the dentistry, so that it will help us to understand what our cats are telling us and how we can understand that better to help them and help ourselves. Thank you. Don't forget to subscribe to my YouTube channel and take care. I'll see you next week. Bye-bye.